All right, my name is Mr. Jake. Thank you for joining my channel. I'm your OET facilitator. Today we are going to solve OET practice test 3, part A, sentence completion. If you're new on this channel, I encourage you to subscribe, click on the like button and share my link. This is going to help to promote the videos and it will encourage me to do more video recordings. All right, so I welcome you to the quiet room and join me on the whiteboard. Okay guys, so our first text A, we know that it is about NF, necrotizing fasciitis, and we know it is a severe, rare, potentially lethal soft tissue infection. The next sentence, the infection progresses rapidly. So we are talking about an infection, okay? NF is an infection. And we have some key features over here. We can see microbiological type. We have type 1, type 2, type 3, and type 4. We have pathogens, okay? Organisms that will cause the infection. We have site of infection, the parts of your body that will suffer the infection. And we have comorbidities, some conditions that will expose you to the infection or will make you vulnerable to the infection. Text B is about antibiotic treatment and it's quite easy to understand. So we label it as medications or drugs because we can see a lot of medications over here. We can see ampicillin, we can see metronidazole, we can see clindamycin. We can also see penicillin over here, vancomycin, daptomycin. So it is all about antibiotics, okay? If your question is about antibiotics or medications, come to text B. Text C, supportive care. So it presents more information on other interventions you can do for patients to help survive, okay? And some of the interventions are cardiac monitoring, aggressive wound care, adequate nutritional support. So these are very crucial to help patients survive. If the question is not talking about medications, however, other interventions or treatments, come to text C. The last text D is about advice to give the patient before discharge. So the next line we have remind the diabetic patient to control blood glucose levels, keep needles capped, clean the skin thoroughly. So you can see it is about health education you can deliver to your patient before discharge. If the question is about any information given to patient, come to this text D. All right, so now we're about to start our questions and answers, sentence completion, okay? So we have questions 8 to 14. Answer each of the questions 8 to 14 with a word or short phrase from one of the text. Each answer may include words, numbers, or both. Question number 8. Which two drugs can you use to treat the Clostridium species of pathogens? So guys, we are looking for two drugs. All right, and it is quite simple. You go to the medication text, then you look for another keyword, Clostridium species, okay, to help you get the two drugs, the name of the two drugs. So guys, we are in the medications text because of two drugs, okay, and we are looking for Clostridium species. You scan quickly, and this is where we find Clostridium species. Now let's start. NF should be managed with clindamycin and penicillin, which kill the Clostridium species. So how many drugs were mentioned? 2, clindamycin and penicillin. Question number 9. Which common metabolic condition may occur with NF? This question is about NF. So you go to the text NF, which is text A. Then you look for common metabolic condition, okay? So we are in NF. We are now going to look for common metabolic conditions. Condition will be under comorbidities. So we have diabetes mellitus, we have trauma, and we have immunosuppression. Among these three, the only metabolic condition here is diabetes mellitus. This occurs when you cannot break down sugar or your body cannot synthesize sugar. All right. Question number 10. What complication can a patient suffer from if NF isn't treated quickly enough? So we are looking for complication, okay? A complication. And we are still in the text NF because it is in the question. We continue to remain in NF because NF is in the question. We are looking for a complication. So we can read, okay? Necrotizing fasciitis, NF, is a severe, rare, potentially lethal soft tissue infection that may develop in the scrotum and perineum, the abdominal wall, or the extremities. The infection progresses rapidly and septic shock may ensue. So, based on what we've read so far, the only complication I can see is septic shock, which may ensue. Okay? All right. Question number 11. What procedure can you use with a wound if the patient can't be operated on? So, we are looking for a procedure, okay? That means an intervention or other management. This is not medication. So we go to the text that contains supportive care. All right. It's not about information, so don't go to text D. It's not about NF, don't go to text A. It's not about antibiotic, don't go to text B. It's about supportive care, so go to text C. We look for procedure. We use wound as a keyword and also operation as supporting idea. In text C, supportive care, we can see wound. So this is a keyword. We can start reading from here. Wound care is also an important concern. Advanced wound dressings have replaced wet to dry dressings. These dressings promote granulation tissue formation and speed healing. Advanced wound healings may lead to healing or prepare the wound bed for grafting. A healthy wound bed increases the chances of split thickness skin graft take. Vacuum assisted closure, into bracket VAC, was recently reported to be effective in a patient whose cardiac status was too precarious to undergo a long surgical reconstruction operation. So I can see surgical reconstruction operation, which is in the question as operation. And the only procedure they mentioned is vacuum assisted closure. They said it has been reported to be effective. Okay, so that is the procedure, VAC. Question number 12. What should the patient be told to use to clean an injection site? So now we are looking for an information or advice you can give to a patient. So be told to use, okay? And we need to go to the text that contains health information, and that is text D, the last one. And we look for a keyword like injection site for the answer. Okay, so in the question, we are aware of what to be told, okay? And that makes it advised to give the patient before discharge. And we are looking for a keyword like an injection. So if you scan quickly, you can see insulin injection here. So we can read. Clean the skin. This is the site, the skin, thoroughly before blood glucose testing or insulin injection. And to use alcohol pads to clean the area afterward. So what are you going to use? Alcohol pads. Question 13. Which two drugs can be used if you can't use vancomycin? So we are looking for two drugs. Because of that, we go to the text that contains medications or drugs. And that's text B. Then we use vancomycin as a keyword for the answer. So we are looking for vancomycin in this chart. We can scan quickly. This is vancomycin. Now we can start. MRSA tends to be covered by vancomycin or daptomycin and linezolid in cases where SRUs is resistant to vancomycin. So in short, you have to use daptomycin and linezolid in a case where SRUs is resistant to vancomycin. So if it is resistant, that means you cannot use vancomycin. So the answer is daptomycin and linezolid. Our last question for the day. What kind of infection should you use tetracyclines for? So we are looking for the type of infection you can use tetracyclines to treat, okay? So we are looking for infections. However, we are dealing with medication, so we go to the text that contains medication or drug. Then we get tetracyclines as a keyword for the infection. We are in text B, antibiotic or medications. We are looking for tetracycline, so we can see tetracyclines here. All right, so we can start from here. If vibrio infection is suspected, the early use of tetracyclines, into brackets including doxycycline and minocycline. So the most important thing here is what we are looking for: vibrio infection or an infection. So we use tetracyclines to treat vibrio infection. You can decide to write just vibrio and avoid repeating infection because infection is already in the question. All right, thank you for your time. My name is Mr. Jake. This is the end of our sentence completion. We will next do recordings on short phrase or answers. See you again. Bye bye.